Hi all, today we are going to discuss humerus. Humerus is the arm bone and the longest bone in the upper arm. Humerus has three parts, the upper end, shaft and lower end. The upper end consists of a head, greater tubercle, lesser tubercle, the intertubercular sulcus or the bicipital groove, the anatomical neck, the surgical neck and the morphological neck. The morphological neck is the junction between the epiphysis and diaphysis. Here we have two important Viva questions. First one is the contents of bicipital groove. They are the long head of biceps and the ascending branch of anterior circumflex humeral artery. And the second one is the structures related to the surgical neck of humerus. They are the axillary nerve and the anterior and posterior circumflex humeral vessels. Coming to the shaft, we have three borders and three surfaces. The anterior border, the medial border and the lateral border. And the three surfaces are the anteromedial surface which lies between the anterior and medial borders, the anterolateral surface which lies between the anterior and lateral borders, and the posterior surface which lies between the medial and lateral borders. And we have the V-shaped deltoid tuberosity on the anterolateral surface where the deltoid muscle gets inserted. And we have the nutrient foramen on the anteromedial surface. On the posterior surface, we have an oblique ridge and a spiral groove below that. The spiral groove or the radial groove lodges the radial nerve and the profunda brachii vessels. Then coming to the lower end, we have a pulley-shaped trochlea and a rounded capitulum. Above the trochlea, we have a coronoid fossa and above the capitulum, we have radial fossa. Here we have a medial epicondyle and medial supracondylar ridge, a lateral epicondyle and lateral supracondylar ridge, and we have a large olecranon fossa on the posterior aspect. The coronoid process of ulna fits into the coronoid fossa and the head of radius fits into the radial fossa when the elbow is fully flexed. And during the full extension of elbow, the olecranon process of ulna fits into the olecranon fossa of humerus. Coming to the side determination of humerus, the head placed at the upper end facing medially and the olecranon fossa should be placed posteriorly. So, this is a right humerus. Then coming to the muscle attachments on the humerus, first let's concentrate on the upper part. Here on the greater tubercle, we have the insertions of three muscles that are the supraspinatus, infraspinatus and teres minor. And we have the insertion of subscapularis on the lesser tubercle. These four muscles that are the supraspinatus, infraspinatus, teres minor and subscapularis are together called sits muscles which forms the muscles of the rotator cuff. Then we have the attachments on the bicipital groove. The lateral lip of bicipital groove gives insertion to the pectoralis major muscle and the medial lip of bicipital groove gives insertion to the teres major muscle. And the latissimus dorsi muscle gets inserted onto the floor of the bicipital groove. This can be remembered as the lady between two majors. The L of the lady stands for the latissimus dorsi and the two majors are the pectoralis major and the teres major muscles. Coming to the attachments on the shaft, we have the insertion of deltoid muscle onto the deltoid tuberosity as we have said earlier, and on the middle part of the medial border we have the insertion of the coracobrachialis muscle. And on the posterior surface, we have the origin of lateral head of triceps brachii from the oblique ridge and the posterior surface below the radial groove gives origin to the medial head of triceps brachii. Coming to the lower part of the shaft, the anteromedial and anterolateral surfaces of the shaft gives origin to the brachialis muscle. Then coming to the lower part, here we have to note that the common flexor origin is located on the anterior surface of the medial epicondyle and we have a common extensor origin on the lateral epicondyle. Then we have the origins of brachioradialis and extensor carpi radialis longus from the lateral supracondylar ridge and that of pronator teres from the medial supracondylar ridge. And on the posterior surface, we have the origin of unconeus muscle from the posterior surface of lateral epicondyle. And finally, some clinical correlations. We have 3 nerves which are directly attached with the humerus, which may get involved in the fracture of humerus. They are the axillary nerve around the surgical neck, the radial nerve in the radial groove, and the ulnar nerve behind the medial epicondyle. Then we have a condition called Volkmann's ischemic contracture, which is occurring due to the damage of brachial artery. So I hope you understood the important points related to humerus. So thank you.